every way. Enjoy that I fight support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Sudden cardiac death describes an unexpected natural death from a cardiac cause within a short time period, generally less than 1 hour from the onset of symptoms, in a person without any prior condition that would appear fatal. Most sudden cardiac deaths are caused by abnormal heart rhythms, also called cardiac arrhythmias. The most common life-threatening arrhythmia is ventricular fibrillation, which is an erratic, disorganized firing of impulses from the ventricles, which is the heart's lower chambers. When this occurs, the heart is unable to pump blood, and death will occur within minutes if left untreated. Sudden cardiac death is not the same as a heart attack. Today on your regular health TV talk show, The Physicians, we'll be discussing sudden cardiovascular death, prevention, and risk factors. Back after the short break. Stay tuned. It's another day with The Physicians, where your health is our business. My name is Dr. Martina Agbere, the regular anchor on this program, and with me is my very elegant, beautiful, Everly, Doctor.
The Minister of Cadre, and of course, welcome to your favorite health TV talk show, The Physicians, where your health is our business, and of course, will always be.
It will always remain our business. Yes, especially what is happening in the world.
The world, yeah. Amidst the chaos, in The Physicians, you find calm
and peace. And you get to hear a lot of information that, of course, are very important to your health. So, Dr. Mia, we're going to be talking about the sudden cardiac death. What comes to mind? Hearing this. Remember we just at the AFCON?
Don't go there.
People that died.
I think that was like about 6 people from what the media told us. And it was so saddening because as young as a youth copper was amongst them. And you just be wondering, you know, there's this kind of myth that comes with it that, oh, it's when you are old. But there was a youth copper amongst them. So it's not about when you are old or you are already having one problem or the other. But the thing is that for us, that was a rude awakening because it's beginning of the year. For us to know, okay, what should we start doing differently? There was a billionaire that died.
Before we actually came on air, one of the camera guys asked, "What is? Tell me what you know about cardiac arrest and heart attack."
Heart attack.
And his response was like they're twin brothers.
That's what he said.
So when we have a consultant that's going on, so I need to also ask him if really cardiac arrest or heart attack.
They are twin brothers.
We'll be back after the short break. Don't go away.
Every day and in every way. Enjoy that I fight support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Welcome to your regular health TV talk show, The Physicians, where your health is our business. Today we'll be discussing sudden cardiovascular death, presentation, and the risk factors. In the studio with me is no other person than our very, very, very cerebral. In fact, I think he has to be in the museum. He is a cardiologist.
Yeah.
Very, very passionate cardiologist, and he does not play with his work. We have evidence of all that he has done. And of course, he is the MD CEO of the United Heart Hospital in Lagos. Welcome, Dr. EUGENE NWOSU to our program.
Welcome, my cardiologist.
I'm actually very excited seeing you because the last time we had you, and that was when my co-anchor heard the bell, something struck, and decided to visit you.
Yeah.
And now you are here, you can actually see how she's looking.
Yeah.
Thank you so much, because she actually took to your instructions, and she's looking
Discipline.
Real discipline. And it takes a whole lot.
I'm very proud of her.
Thank you, sir.
I'm
Thank you,
actually
sir.
excited. You actually have done a very good job, and I can tell you she's actually keeping really fit.
I am.
We appreciate you. Thank you for keeping my co-anchor alive.
She's a doer, not
Yes.
a talker.
Yeah, I want the talk.
I give you thumbs up for that. So let's go straight to God. I know we don't have a lot of time, and I know you love to really break it down. I can see the heart here. I know, viewers, I hope you have your paper and your Bible, because Dr. NWOSU, when it comes to things that have to do with the heart, you need to just keep up a pace with him. Dr. NWOSU, please, let's start by giving, first of all, let's talk about giving us statistics of how common it is, bearing in mind the AFCON that happened, the people that died. What is the statistics of this?
Yeah, basically, cardiovascular death is the #1 killer all over the world. It's not just in developed world like Europe and United States, because it's also happening in Nigeria. In the past, it used to be infectious diseases and all that stuff. But right now, with the risk of hypertension and how common hypertension is, Nigerians, young and old, are beginning to have, cardiovascular disease, cardiovascular coronary artery disease.
Okay.
And the interesting thing is that these things are sudden, and most times people don't have any symptoms. They don't know that they are just a walking time bomb.
Okay.
So in this discussion, we will explore some of those things. Even though sudden cardiac death most of the time does not give warning, but if you really pay attention, it is staring in your face. Let me just take the liberty of telling you that when we are talking about cardiac arrest or sudden cardiovascular death, it's not just heart issues. When you have a cardiac arrest, by definition, as you said, sudden cessation of heart function, okay, and the heart is not able to pump blood. Okay, there are different causes of it. We're going to explore that. But when you have a sudden death, you hear that somebody just dropped dead suddenly. There are 3 organs to keep it. One is a heart issue, one is a brain issue, and one is a lung issue. So brain issue, massive cerebrovascular accident, that is hemorrhagic stroke. Somebody has a massive stroke. Usually the blood pressure is extremely high. Sometimes they don't even know, or they know they have high blood pressure, they are not paying attention. And the arteries in the brain will just rupture.
Wow.
And you have bleeding into the brain tissues. Those people will suddenly collapse. And what will now lead is cardiac arrest. Okay? That's #1. Also, there are people that have aneurysm in the brain. Aneurysm is a weak spot in the arteries. What you have heart portion, and suddenly, even with very minor blood pressure, it can just rupture, and they have a lot of blood in the brain tissue. That can also lead to massive hemorrhagic stroke. The second one is pulmonary embolism. You have a big clot that lodges in the arteries in the lung, the pulmonary arteries, and then preventing any blood flow to the lung, and that will result in very low blood pressure and then cardiac arrest. And then finally, the one that everybody talks about is cardiac arrest, which is primarily a heart issue.
Okay.
And there are 2 types of cardiac arrest. First of all, let me give you an analogy.
Okay.
You have water in the well, and you need to pump it to the tank. So you need the electricity to prime the pump. And then once the electricity is on and then it's pumping, then you need to have an open pipe to carry
water up.
So the same thing in the heart. The heart is a pump, and you need an electricity to prime the heart to contract. So you now have normal sinus rhythm, that will now stimulate the heart to now pump. And then when the heart pushes blood out of, it needs to go through the arteries. So if the artery in the heart suddenly develops a blood clot through a process we call a plaque rupture, then there's no blood flowing through those arteries.
Exactly, yeah.
And most people, that is actually the onset of heart attack. Okay? When the artery completely closes, that blood does not go through, some people will just fibrillate. They go into cardiac arrest. 50% of the time, people are having cardiac arrest. Heart attack, it presents as cardiac arrest. Some people are lucky, they don't fibrillate. They start having excruciating chest pain. And if you don't get immediate treatment that will open the artery, then after about 4 to 6 hours of complete blockage, you will now suffer a heart attack. And that heart muscle is damaged and will never recover.
Oh, wow. So,
the question is, what is the difference between cardiac arrest and
heart attack? Yes.
So, cardiac arrest is the electrical issue. The heart suddenly, instead of beating normal, boom, 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 the heart starts quivering. The ventricles, the lower chamber, starts quivering, and that quivering is not effective. It's not able to pump the blood. So cardiac arrest, most often or always, is through the pathway of ventricular fibrillation or tachycardia. But heart attack is simply that the vessels that run on the surface of the heart, this is the coronary vessels, there are three of them, they have a plaque buildup that you are not even aware of. They're there. And that plaque buildup will now, it might be just 30% blockage, 40% blockage, which does not cause any chest pain. You can run a marathon, climb stairs, you don't have it. But there are triggers that can cause it to break open, what you call a plaque rupture. So when you now have a plaque rupture, if it's on the heart surface and it attracts blood clot that closes the artery 100%, that there is no blood flow. In the heart, that's a heart attack. In the brain, that's a stroke. Okay. So the point is, what causes plaque rupture?
Exactly.
Because the process of plaque buildup starts from in the teens.
As young as that.
Atherosclerosis grows. Okay. In fact, I showed a nice picture that showing how it grows in your 20s, in your 30s, in your 40s. So I have plaque. Everybody in this room has.
Every day and in every way, enjoy that I find support. No matter the role you play, EUGENE pack supplements for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Welcome back. If you have just joined us, you're on to your regular health TV talk show, The Physicians, where your health is our business. We've been discussing sudden cardiovascular death. And in the studio, Dr. EUGENE NWOSU, a consultant cardiologist and the MD CEO of United Heart Hospital, have been doing justice to that. I'm sure you have been wondering, wow, so is this how it happens? And before we went to break, he actually said a whole lot, and I had to stop him when he was going to talk about the plaque rupture. Dr. NWOSU, thank you so much for all that you have said. Now we want to go to the different mechanisms of a cardiac arrest, and we are just going to breeze through when you started with the plaque rupture. Can you tell us the mechanisms, please?
Okay, so two mechanisms of cardiac arrest is the pipe issue, which is problem in the artery, usually from plaque rupture, or the abnormal electrical activity of the heart. So let's talk about plaque rupture. What is plaque? Plaque is the gradual buildup of cholesterol inside the wall of the arteries. And it usually starts in your teens and progresses. By the time you are in your 30s and 40s, you have it. Okay? And that is cholesterol inside the artery that is not supposed to be there. So the body tries to fight it, send macrophages, the infantry soldiers, and they go there and they cause a lot of inflammation. And that plaque usually is very small. Anytime your arteries are clogged up less than 60%, 70%, you don't even have any problem. You don't have chest pain with exercise. So a lot of people are sitting down on plaque waiting to rupture. They never had any complaint. So what are the things that will make the plaque rupture? All the risk factors of coronary artery disease, very, very high blood pressure can cause it. Rapid heart rate, like tachycardia, can cause it. So, for example, during the South African-Nigerian march, people were so much into it, fear, anxiety about the penalties, and their blood pressures are high and the heart rate is high. Boom, plaque rupture. The plaque ruptures and a blood clot quickly forms and blocks the artery in the heart. They go into cardiac arrest. So people that you hear some people go into the hotel room, they are messing around with some other guilt, shame, depression, can lead to increase in heart rate, and you can have a plaque rupture and die right there in the hotel room. Okay? People that have inflammation, infection, one of the commonest cause of plaque rupture is poor dental hygiene. People that are not cleaning their teeth twice a year, you have a lot of infection. Inflammation and infection can cause a plaque rupture. That is why in places like United States and Europe, there's a lot of heart attack during the flu season. And that is why part of that is flu shot, influenza vaccination.
Take your flu shot.
And people that have pneumonia, the risk of plaque rupture and heart attack is also high with infection. Okay, cocaine use, people that use cocaine and all some of those street drugs, their blood pressure and heart rate can go up, and they have cardiac arrest. So those are the causes of plaque rupture. Now the second mechanism is ventricular tachycardia or fibrillation, where the heart suddenly starts misbehaving, firing very fast. And usually there are certain risk factors for that. People that have heart failure is when the heart is not pumping enough blood to meet the needs of the body. One type of heart failure is when the pump is weak. The ventricle, normal ventricle does this. You see some of these people, their heart is very weak and they're just doing like this. That can lead to ventricular tachycardia and fibrillation, and they die suddenly. So those people have been known to have heart failure for years or months, and suddenly they just drop dead. And they're saying, he was good yesterday he was talking, and then he can do that. There are people that have left ventricular hypertrophy, enlarged heart. The muscles of the ventricle, left ventricle, is very, very thick, and that can predispose them to irregular heartbeat, PVCs, and ventricular fibrillation and
ventricle is the lower part
so the ventricle is the lower part. The left ventricle right here. This is the right ventricle. This is the left ventricle. This is the one that pushes blood to the circulation. The right ventricle pushes blood to the lungs. So people with hypertension or obesity that has an enlarged heart and the heart muscles are thick, it has fibrotic tissue and it predisposes them to irregular heartbeat, PVC, and suddenly they can have ventricular tachycardia and fibrillation. Okay, there are some people with abnormal inherited abnormality where their ECG is abnormal, like Brugadier syndrome or long QT syndrome. Those people have family history that members drop dead. There's also a type of heart muscle disease called hypertrophic cardiomyopathy. It also runs in, there's some familiar tendency. You hear that the father or mother drop dead. They can also predispose to that. So these are the different mechanisms. And also, very low potassium.
Wow.
People that are on diuretics, or they don't eat enough vegetable and their potassium can go very low. They can have ventricular tachycardia.
Diuretics used to manage
water pills. Okay, so they take it. They don't go to doctor. They don't check the electrolytes and potassium. They are at risk of sudden cardiac death. Also, low magnesium can cause it. There are certain medications that can also cause sudden cardiac electrical problem. Some people don't tolerate chloroquine, hydroxychloroquine. During COVID-19, it was very popular.
That was a rave.
Yeah. Hydroxychloroquine. There are some antibiotics that can cause that. And there are some medications that we use to treat abnormal heart rhythm, what we call antiarrhythmics. Some of them have side effects or even causing more of that and resulting in cardiac arrest. So for people that are on such medications, it's very important that they follow with their doctors and get checked on a regular basis. So in summary, plaque rupture from pipe issue, clogging up suddenly, and electrical problem, where you go into tachycardia or fibrillation. These are the two causes of cardiac arrest.
Mechanism.
So
And I like
you
the
talk
fact
about
that
the
you are...
major causes of cardiac arrest, right? And you also talked about those on diuretics, probably because of the potassium also. I think it would be nice for us to know the presentation. Because it doesn't have real symptoms, how would they present? And with this, if somebody's potassium is low, how will the person also present?
Please. Cardiac arrest usually does not have any symptoms. People are just walking time bomb. Okay? They walk into the bank, they slump dead. They go to watch a football match, they slump dead.
Then they are home watching TV.
They're even sleeping.
So usually majority of the people don't have symptoms. But occasionally, sometimes just before it happens, you feel certain symptoms, but it's too late to do something. Suddenly you might just feel some chest discomfort, or you feel that your heart is fluttering and you faint, or you can't breathe, you are short-winded, or some people will even have nausea and vomiting, and boom, they collapse.
So how will they know?
So the point is, know your risk factors
and your numbers.
Don't even wait for treatment because it's too late. Okay, when it happens, the recovery is not good. So prevention is better than cure. So we will emphasize the risk factors. When I see people in my heart, I say, this is a
and I think that is the point we should nip in the bud now. Yes. Those risk factors for our viewers and the preventive measures, so that people will know, look, he said this, I'm a ticking time bomb. I need to be able to do, because you, like you said, no symptom. So it's good for you to know.
So these are the risk factors, and these things are all preventable.
Oh wow, unfortunately this is how far we could go for today. Just wait for the concluding part next week for the part 2.
Every day and in every way, enjoy that I fight support. No matter the role you play, EUGENE packs supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.